Hi, my name is Julie Zeller, and this is my presentation, Healthcare Legislation and the Support of Childhood Cancer Research. Objectives. After listening to this presentation, my colleagues will be able to understand the Childhood Cancer Survivorship, Treatment, Access, and Research Act of 2018 by the 115th Congress of the United States of America. My colleagues will be able to recognize the importance of research in childhood cancers and the importance of follow-up care in children diagnosed with cancer. They will also be able to recognize Caroline Price Walker and her role in the drafting of this bill. Thesis statement. The purpose of this presentation is to highlight the importance of this bill and its opportunity to provide nurses with more research, treatment options, and other therapies for their pediatric cancer patients. My bill is called Childhood Cancer Survivorship, Treatment, Access, and Research Act of 2018. This bill was first introduced in 2008 by Representative Deborah Price after the death of her daughter, Caroline Price Walker. The bill then was called Caroline Price Walker Conquers Childhood Cancer Act. This bill was signed by President George W. Bush. It was reintroduced and renamed in the 115th Congress of the United States of America by Democratic Senator John Jack Reed of Rhode Island. This bill was signed by the President on June 5, 2018. The purpose of this bill states to maximize discovery and accelerate development and availability of promising childhood cancer treatments and for other purposes. Caroline Price Walker. This bill is in recognition of Caroline Price Walker, who was the daughter of former Representative Deborah Price. Caroline was diagnosed with a neuroblastoma in 1998. She was 8 years old. She underwent chemotherapy, radiation, transfusions, and many surgeries. Caroline was in remission for almost a year until one day she was getting ready to return to school after summer vacation. She began to lose her motor skills and speech. Her cancer had returned, and this time it was in her spine and brain. A few days later, at the age of 9, Caroline passed away. This devastating personal event sparked Congresswoman Deborah Price to raise money in hopes to prevent this tragedy from happening to other families. Being a Congresswoman at the time gave her a voice and a national platform. Her personal experience demonstrated to her the need for national approach to childhood cancer research. Her bill was first introduced to the House and the Senate in 2008 and was unanimously passed. The purpose of this bill is to build upon, expand, and improve federal funding for children with cancer. Every 5 years since 2008, it has been reauthorized by Congress. This speaks to the importance of this bill. Each new Congress has continued to pass and reauthorize Caroline Price Walker's bill. Overview. According to the Congressional Childhood Cancer Caucus website, 36 children every day will be diagnosed with cancer, and 2,500 children will die each year. This legislative bill has 3 main focus areas. The first is to improve childhood cancer surveillance and research. The second is to provide a pediatric doctor on the board of the National Cancer Institute. The third is to maximize cancer tracking and biospecimen banking. This bill is important because it increases funding for childhood cancer research. Adequate funding has been difficult because childhood cancers are a relatively small percentage of all cancers. This bill recognizes our country's children as valued citizens whose specific issues need to be addressed. Pros. This bill provides $30 million over 5 years to provide funding for several focus areas. The first focus is on childhood cancer research and development of drug therapies. It costs millions of dollars to bring a drug through research development and then to the consumer. This bill is particularly helpful in providing government funds to spur the research and development of drug therapies for rare childhood cancers, which normally would not be profitable for companies to do on their own. Another area of funding is for the collection of data from patient follow-up care. Are there any correlations between children diagnosed with cancer and those same children developing cancer in adulthood? Is there a genetic makeup that makes them more likely to develop cancer? These are questions where data has been lacking in the past, and this bill will provide funding to improve data collection. Also, this bill will provide funds for the creation of biobanks of childhood cancer specimens. These banks will hold samples of tumor tissue, bone marrow, blood cells, and DNA. Biospecimen banks are valuable because not only do they provide the sample, but they will provide a national registry and a link to nationwide databases for research purposes. The final provision of this bill is a designated pediatric seat on the National Cancer Advisory Board. This representation gives a voice to pediatric patients as this national board sets its yearly agendas. Cons. It's hard to think of cons when we are talking about research for childhood cancer. Everyone can relate to the horror and distress of a family whose child has just been diagnosed with cancer. As empathetic people, our gut reaction is that no expense be spared to save a child. But the reality is that research and treatments are expensive. The only negative connected with this bill is that it provides funding targeted to a very small number of patients relative to the larger group of all cancer patients. Childhood cancer deaths are 0.42% of all U.S. total cancer deaths per year. The question has to be asked, is this the best use of government funding? Evidence-based research article. My research article is found in the Journal of Turkish Archives of Pediatrics. The title is called The Role of Surveillance Screening in Detecting Tumor Recurrence After Treatment of Childhood Cancers by Pelin, Tiki Kisa, and Suna Amir. I chose this research article because it focuses on the importance of close follow-up care after children diagnosed with cancer. According to this article, there can be up to an 80% survival rate for children who undergo cancer treatment. Follow-up care is especially important in children because they need to be monitored for late effects of treatments as well as recurrence. As we know, chemotherapy and radiation are effective in treating cancer, but could be damaging to the body. The bodies of children are still developing, so these harsh toxins and treatments can be detrimental to their overall development. Even after children have been successfully treated for cancer and are in remission, there is still a very high risk of tumor recurrence within the first 5 years following treatment. Close follow-up care and surveillance is essential for treating childhood cancers. This research study followed 420 patients that were diagnosed with childhood cancer over a 9-year period. Some of these cancers include non-Hodgkin lymphoma, Hodgkin lymphoma, neuroblastoma, Wilms tumor, and others. After their specific treatments were concluded, they were required to continue follow-up appointments at the researcher's pediatric oncology department. The study participants were seen every 3 months in the first year following treatment, every 4 months in the second year, every 6 months for the next 2 to 5 years, and annually after that. At these appointments, participants would have physical examinations, chest x-rays, abdominal ultrasounds, CT and MRI scans, and laboratory tests. The results of this study were very interesting and certainly relevant to further understanding childhood cancer. Of the 420 participants, 15% had tumor recurrence. Within this group, 44.4% had recurrence within 12 months after treatment. 34.9% had recurrence 12 to 24 months after treatment, and 20.6% had recurrence 24 months after treatment. Of the 15% of children with tumor recurrence, about 1/3 presented as symptomatic with pain, headaches, or swelling. 2/3 of that group with tumor recurrence were asymptomatic, meaning they did not have any symptoms but had abnormal test results, scans, or their tumors were found on a physical examination. The significance here is that 2/3 of the participants with cancer recurrence were asymptomatic. Had they not been involved in this thorough follow-up monitoring, their recurrent cancers would not have been discovered. Follow-up care clearly can make a significant difference in survivability of recurrent cancer. The bill that I chose for this presentation has one area where it focuses on the importance of follow-up care. Unfortunately, this can be financially hard on families as tests, imaging, and laboratory tests can be very expensive. Fortunately, part of this bill provides funding so families make sure their children receive the proper follow-up care they need without having to worry about the financial burden it may cause. Personal views. No matter what age someone is when diagnosed with cancer, it's devastating news. Cancer is a life-changing diagnosis. Normal life for a family ceases to exist. The new normal is a life full of doctor's appointments, hospital stays, surgeries, and medications. Now, think about all of this from the perspective of a child, someone full of life and hope and possibilities. There is something especially chilling when one thinks of the juxtaposition of all the innocence and hope against all the fear and pain of a cancer diagnosis and treatment. Of course, we want to help, but as a society, our focus is usually to do the maximum good for the maximum number of people. This usually works satisfactorily, but for people with rare diseases and for childhood cancers, this system doesn't provide as much impetus to fund research and development of treatment for their rare conditions. The Childhood Cancer Survivorship, Treatment, Access, and Research Act of 2018 is so important because it puts the focus on children. This bill provides the tools, the funds, and the resources to give these children more of a fighting chance. This bill focuses on the research into childhood cancers, improving follow-up care, a voice on the National Cancer Advisory Board, and the creation of childhood cancer registries and biospecimen banks. This bill has been reauthorized by Congress every 5 years since 2008. This level of support by the United States House of Representatives and Senate clearly demonstrates the relevance of tackling childhood cancers. And these are my references. Thank you.